Hello all, welcome to my channel UGC Social Medicine and Community Health. In this video, we will discuss about the topic which is very important for the UGC NET exam, that is demography. So what is demography? Demography is nothing but it is a scientific study of human population. That means collecting the data of a population. That means count of a population and whether the population is increasing or decreasing in a particular country, and also in a particular count of a population how many people are males, how many people are females, and how many people are educated, and how many people are doing jobs. So collecting all these type of data is called as demography. Next, what will demography mainly studies? Demography mainly studies changes in population, composition of the population, distribution of the population. So we will discuss one by one. First, changes in population size. For suppose last year in a particular area there are 10,000 population. This year 10,500 population are there. So comparing to the previous year, this year population has increased. So that type of information comes under changes in population size. And next, composition of the population. Composition of the population is nothing but characteristics of the population. In changes in population size, we are comparing the population whether it is increased or decreased. But here in the composition of the population, we are knowing about the characteristics of the population. That means in a particular count of a population, how many people are males, and how many people are educated, and how many people are doing jobs, and how many people are married. So all these type of data comes under composition of the population. Next, distribution of the population. Distribution of the population means where the people are living and how the people are spreading in different areas. For example, in cities and towns there are large population because of their jobs and their children education, but in rural and forest areas there will be less population. So that is the meaning of distribution of the population. Next, what are the five demographic processes? There are five demographic processes that continuously change the population. So what are they? Fertility, mortality, marriage, migration, social mobility. These five demographic processes will continuously change the population. So first, fertility. Fertility means a woman, how many number of births that a woman will give. So that is the meaning of fertility. So if more number of births, then population will be increased. So like that, fertility will continuously change the population. Next, mortality. Mortality, it is nothing but number of deaths that occur. So if more deaths occur, the population will be decreased. So like that, the mortality will continuously change the population. Next, marriage. How marriage will continuously change the population. Some people will get married very late, that means after 30. So the chances of giving birth to a child are very less. So the population will be decreased. Some people will get married very early, so that the chances of giving birth to a child are high. So the population will be increased. So like that, marriage also continuously change the population. Next, migration. Migration is nothing but people are moving from one place to another place. For suppose some people are leaving village to cities or towns for due to job purpose or children's education. So here in villages population is decreasing, and in cities and towns population is increasing. So like that, migration also continuously change the population. Next, social mobility. Mobility. Social mobility is nothing but social or economic status of a family. For example, from a low income family, a person studied well and he or she get a good job, so that their social and economic status was changed, improved, so that they can eat a healthy food, nutritious food, so their health can get improved and they can live longer. If the person did not get good job, so that they are still in a low income family only, so that they can't eat healthy food or nutritious food, so that their health will be spoiled day by day, and eventually that will lead to death also sometimes. So the death count will be increased. So like that, the social mobility also continuously change the population. Next, why is population important in a community medicine? Community medicine concerned with the health of a community or a group. Health of a community depends upon relationship between number of people, space or resources available, ability of people in society to meet their needs. For example, in a small area there are large population. with few houses, very less houses, and few very less hospitals, and no safe clean drinking water, all these things. So people health will be spoiled, right? If there are enough sources, like enough houses, enough hospitals, and safe drinking water, if there are enough sources, then people will live healthier. So like that, this community medicine will study the population and plan to uh, build a hospitals, houses, and to provide safe drinking water. Like this, the community medicine will plan. Next, what are the main sources of demographic status in India? What are these demographic statistics? So, till now we have discussed the demography. That means collecting data, types of data. So, how we will collect these different types of data? With which methods we can collect these different types of data? So, through the help of these four methods, we can collect all these type of data. First one, population census. Second one, national sample surveys. Third one, registration of vital events. And fourth one, ad hoc demographic studies. First one, population census. It is a official method of counting the population. Through this method, we can come to know the count of the population, whether the population is increasing or not, and how many people are educated, how many people are doing jobs, and how many males are there and how many females are there. Like that, these type of data we can collect through this population census method. Next, national sample surveys. National sample survey means through this method, in this method we will collect the data from selected group only. With that data we can we can understand the large population. Example, researchers collect the data from selected group, and with that data only he or she will analyze all the information and come to one conclusion. And next, registration of vital events. For every individual, the vital events are very important, like birth, death, and marriage and divorce. So registration of birth and registration of death, with these registrations the data will be collected. And next, ad hoc demographic studies. With this method, if there is any particular purpose only, we will use this method. For suppose in a particular area there are high infant mortality rates. Why there are high infant mortality rates in that particular area? So for this purpose we will use this other demographic studies. So this is all about demography. In the next video we will discuss about the demographic cycle. So this demography will be available in the Parks textbook, page number 566. If you have any doubts about this demography topic, you can comment down. If you like this video, please like, share and subscribe. Thank you.